Yeah, you got a question? Far away.
Yes, we have some questions that have been asked, and one of them is that many patients are dependent on beta blockers for their POTS. What do they do?
Okay, well, beta blockers will probably make the POTS worse, because what POTS is a symptom of poor energy delivery mechanisms to the heart. Now, if you have got poor energy delivery mechanisms to the heart, it means it cannot beat powerfully as a pump. So instead of getting 70 nice strong beats every minute roughly, you get these rather weak flabby beats. And the first thing that happens is the blood pressure starts to fall because the heart is not beating very powerfully. And the second thing that happens is the heart beats a little bit faster. So your resting heart rate is faster than normal, maybe 80 or 90 beats per minute. Now, we need the heart to circulate blood around the body. And people with very severe fatigues lie horizontal, because it's much easier to pump blood, on the flat than it is, uphill and down dale. So POTS really becomes a problem when you stand up and you go vertical, because when you go vertical, it's much harder to send blood around the body. It requires more energy. The heart cannot beat any more powerfully. And so it tries to maintain cardiac output by beating faster. So that's the first bit of the syndrome. You get this tachycardia when you stand up. But of course, that too is demanding of energy, and you haven't got the energy for that to be maintained. And so the heart then beats even less powerfully, and then the blood pressure drops precipitously, and typically you fall over. And that's a problem. Then if you fall over, then that's no good at all. So POTS is part of poor energy delivery mechanisms, and the way we treat that is to improve energy delivery mechanisms. Paleo-ketogenic diet, sort out the fermenting gut, take the basic package of supplements, improve mitochondrial function, thyroid and adrenal function. So POTS is all part of that.
A lot of ME patients, they were perfectly fit until they got some kind of infection. What do you think is causing
well
this?
Any number of infections can cause ME. The one that comes up time and time again is Epstein-Barr virus, or mono or glandular fever, which is a common infection that young people get typically at school or at university, and that is a major driver of ME. We now know that we have a new syndrome called long COVID, but the clinical picture is the same as ME, and that is driven by chronic coronavirus infection, and we will talk about that in the second half. But any infection can trigger. So I've seen fatigue syndrome triggered by gastrointestinal infections like Giardia, like amoebiasis. I've seen it following flu-like infections, but any herpes virus, shingles. So any viral infection can trigger ME, and it does that in two ways. First of all, many of these infections inhibit mitochondria. They stop them working well. And the second point is if the immune system is not functioning well, if it doesn't have the energy to work or the raw materials to work, or it's not directed well, then you get this immune reaction which isn't adequate. It isn't sufficient to get rid of that infection, but it is sufficient to make you ill. And again, the symptoms of ME, of chronic inflammation, are people just feel flu-like all the time. They feel like they've got flu, but they just can't get rid of it. Very often low-grade fever, or they've got their glands are up, they've got pain, widespread pain in their muscles and their joints. Their sleep is disturbed because the brain is inflamed. So it's a whole host of other symptoms in addition to the symptoms of poor energy delivery mechanisms. So yes, infection is a powerful trigger for ME. And this is why you must all be aware of what I call groundhog acute, because the way to, or the best way to treat chronic infection, of course, is not to get it in the first place. And 90% of infections come in through the mouth, either because we inhale them, or because we eat them, or because we drink them. And those microbes that are inhaled get stuck on sticky mucus, which should be coughed up and swallowed. So having a nice acidic stomach is a very important defense against many diseases. And of course, if you've got an upper fermenting gut, then you don't have an acidic stomach, and therefore you're more susceptible to infection. But please, all of you, I beg you, look at my groundhog acute regimes, and at the first hint of any infection, take big dose of vitamin C and sniff iodine, because that cleans up microbes that are in the respiratory tract, and that will keep the loading dose down and allow you to deal with that infection efficiently. But absolutely right, infections are major triggers of ME.
And we have one of the users who have asked the question. I've been using the carnivore diet with only 10 carbs from 200 grams of liver and eggs per day for half a year. I don't come in ketosis as I should on the breath test. I can only come in ketosis if I'm fasting for 48 hours, tried one time. Would it be recommended to test fasting insulin?
Well, that will help. But the first point is a carnivore diet is a perfectly healthy diet. And I note you're having a lot of liver. Liver, of course, is where animals store glycogen, which is quite a large carbohydrate source. There's quite a bit of carbohydrate in liver. I have to say, I'm surprised you're not in ketosis by doing a carnivore diet. Maybe try to increase the fat content of the diet, because, as I say, one can make sugars from protein, and that's called gluconeogenesis. But my guess is that maybe your breath meter isn't sufficiently accurate. That's why I like the ACE tracks. And but I'm amazed you're not in ketosis. And I'm sure you are in ketosis. I'm sure if you measured your blood beta-hydroxybutyric acid, that would be high. So do check your measuring technique. But I'm very happy you're doing a carnivore diet. That's a perfectly healthy diet.
We have another one asking. I've been doing the Wim Hof breathing exercise on and off. From what you say, she understands it's a bad idea since it's alkalized the blood. Is that correct?
It will in the short term. But I mean, the point about Wim Hof is you do the hyperventilation exercises for 2 or 3 minutes, and then of course you stop. And you stop breathing completely. And when I went on a Wim Hof course, following the hyperventilation, I found I could hold my breath, I think, for 3 minutes, and I didn't feel any desire to take a new breath. So Wim Hof, for some people, works brilliantly well, and I'm very happy for you to do that. But Wim Hof's exercise, you'll hyperventilate while you do that, but then you have a window of time when you do the other thing and you stop breathing. So on balance, you're going to end up breathing correctly. And I'm a great fan of Wim Hof. I think he does amazing things, and is very helpful for many people.
What is your view on fasting?
Well, fasting can be a very useful tool. Now, people listening now, don't start off with fasting. Fasting has been used for centuries to treat a whole range of conditions, including cancer, to great effect. Fasting may well be a very useful treatment for spike protein, because what you do when you fast is you switch on autophagy, or self-eating, or autophagy, however you want to pronounce that. So it's like giving the system a spring clean. It helps kind of reset the immune system. So I'm a great fan of fasting, but it's much easier if you do that from a position of strength. And that position of strength is get into ketosis first. Once you're in ketosis, fasting is easy. Now, with diet, it's always an evolution. And people come to me often as carbohydrate addicts. And we have a saying in this country, Rome was not built in a day. And we have to start with the diet and start low carb, and then gradually get into ketosis. And then maybe the next step is to do time restricted eating. Many people find benefit from eating all their food in a 6-hour window of time. Some people choose to have just one meal a day. If you do choose to have one meal a day, don't have it too close to sleeping, because that can disturb sleep. And then many people, having established all that, and it's easy, once they find that fasting is easy because you don't get hungry, you don't run out of energy, the brain works just as well, the body works just as well. Once you've established that, then intermittent fasting is very easy. And some people choose to do 1 day a week, or maybe 2 days a month, or maybe one week in a year, or whatever. Everybody is slightly different. But fasting is a very useful tool. As I say, it spring cleans the system, it gets rid of proteins, and those proteins include dead cancer cells that are circulating. Remember, we're all producing cancer cells all the time. Throughout life, just background radiation will generate about 10,000 mutations every second. And we know mutations, particularly in mitochondrial DNA, that's where we're talking about, will drive cancer. And some of you are probably aware of the work of Thomas Seyfried, who is a physician. And I can remember him saying on one podcast, if we all fasted for 1 week in every year, you could probably halve the incidence of cancer overnight throughout the world. It just illustrates the point that intermittent fasting is very helpful to protect us from cancer and say to reset the immune system and give ourselves a spring clean. But don't do it until you're well keto adapted, because at that point, then it's easy. You can do it without getting hungry and without running out of energy.
The patients that follow your recommendations, to what extent do they get better or recover?
Oh, well, they all make movements in the right direction. Now, I can never guarantee a complete recovery for everybody, because I'm still on a steep learning curve. And what's got in the way hugely recently is COVID and long COVID and COVID vaccines, because most of my fatigue syndrome patients, if they have a COVID vaccine, it almost invariably makes them worse. So most of my patients do see benefits, but the important point here is that all these interventions are also the starting point to prevent cancer, dementia, and heart disease. So what I can say to my fatigue syndrome patients is, you will survive much better. You will live a longer life because you are so much healthier than you were before. So the majority of people see worthwhile improvements. And that's why I'm able to take on new patients. I'm taking on new patients all the time. And that's because my old patients are getting better. They're not coming back to me. So that's usually a fairly good sign. And because the regimes are now so standard, there are no secrets here. It's all in my books. Because they're so standard, that's why I feel doing webinars like today is useful. Because, I know the things that work, I know the things that don't work. And believe you me, I've pursued many blind alleys and done many, many wrong things. But I now know that these simple interventions, these simple naturopathic interventions with diet, supplements, monitoring things to make sure you're getting there, make a massive difference to the vast majority of people.
I have almost no ME or CFS symptoms while being pregnant. Can you explain why?
Oh, that's so interesting. Sometimes it goes the other way. But when during pregnancy, the body has a major immunological problem, because the baby is genetically different. The baby obviously gets genes from father as well. And so what would normally happen is, you would think, is something that's very genetically different in the body would reject it, just like you would if you had a tissue transplant. So to stop the mother from rejecting the baby as a foreigner, as a tissue transplant, there's a massive outpouring of hormones, female sex hormones, adrenal hormones, in order that mother is immunosuppressed. And that immunosuppression stops the pregnant mother rejecting the baby as a foreigner. Of course, if that didn't happen, then no pregnancies will be possible. So if you are feeling better when you're pregnant, that suggests that you've got an inflammatory drive in your body, because the pregnancy hormones damp down that inflammation. They damp down the immune system and stop it, say, rejecting the baby. So it's a useful clinical clue. It suggests that there's some inflammatory driver in the body that we need to tackle. And we'll talk about that in the second session when I talk about ME at 3 o'clock.
Then we have one that's a little bit related, but do you find treatment with I'm not pronouncing it correctly, pregnenolone and or DHEA helpful for ME? And if yes, how do hormones help people, Amy, in your experience?
Okay, well, yes, for some people, those hormones are very helpful. Now, I'm not using them in doses to cause immunosuppression, but the adrenal gland, as I say, it's the gearbox of our car, and we lead very stressed lives. You know, we're busy working, we've got families to look after, being ill is incredibly stressful, and if the body is in a state of constant stress, eventually the adrenal glands will fatigue. Now, the extreme form of this is called Addison's disease, and that's what the endocrinologists recognize. And thankfully, that is very rare. But we're not talking about complete adrenal failure. We're talking about adrenal fatigue. They simply get tired. And what often helps the adrenal glands is if you give them some of the raw materials that they need in order to make adrenal hormones physiologically. So all adrenal hormones start life as cholesterol. Cholesterol is produced by the liver. Cholesterol circulates in the bloodstream and it's picked up by the adrenal glands. In fact, there's very high concentrations of cholesterol in the adrenal gland. And the first thing is that pregnenolone is made. So pregnenolone is the most upstream of all the adrenal hormones. And then pregnenolone gets converted to DHEA and then to cortisol and then to the sex hormones like progesterone, estrogen, and testosterone. So I'm not an advocate of hormone replacement therapy like testosterone, estrogen, cortisol, because that's so difficult to control. But I am a fan of using pregnenolone and DHEA maybe to allow the adrenal gland to work more easily. It reduces the friction in the system, if you like. Now, we can test for that. There's a very useful test called an adrenal stress profile, which is a saliva test. And that measures DHEA and cortisol in the saliva, at 4 samples over 24 hours. And that can give us a very useful handle. And we can correct that with pregnenolone, and a dose would be 25 to 100 milligrams would be a reasonable dose. DHEA, maybe 25 to 100 milligrams is a reasonable dose. And then there are some herbs which are very helpful for adrenal function, like ginseng, for example. And very often people just find out by trial and error that ginseng is helpful to them. Ashwagandha, again, is another very useful herb for the adrenal gland. And there are more details about this in my thyroid book about to help improve adrenal function. But yes, those interventions often helpful. But I can't emphasize enough the importance of doing all this stuff in the right order. So don't just jump in there with some pregnenolone and expect that to do the business. You start with the diet, then you sort out the upper fermenting gut, and then you add in a basic package of supplements. And then we start correcting the mitochondria, and then we go on to the thyroid and adrenal glands in parallel. Again, on my website, I think it's under the protocol, the order of application of all these interventions. It's important to do it in the right order, but so don't just start off with pregnenolone.
So you have to use the rocket steps correctly.
Yeah. You got it.
We have another user who's asking, I tend to quickly get symptoms of vitamin D toxicity symptoms whenever I take as little as 5 micrograms. I take it with magnesium citrate. Do you have any idea why this happens? Okay,
well, microbes in the upper fermenting gut are hungry for B vitamins. And some people, if they just take B vitamins without sorting out the upper fermenting gut, then they ferment harder and that can make them ill. Another possibility is that, you can be allergic to B vitamins, especially if they're yeast derived. So just bear that in mind. And of course, whenever we put in any intervention that allows the body to heal and repair, whatever that intervention may be, then you risk getting detox reactions and you risk getting die-off reactions. And this is why, sometimes putting the interventions in place is difficult. And the iller you are, the sicker you are, the slower we have to go with all these interventions, because we risk getting detox reactions and we risk getting die-off reactions. And if you've got a therapist, then very often that's the tricky bit, is balancing this all up. So you've got to go down, you've got to walk the walk, but you've got to walk it slowly and be kind to yourself. But it's being intolerant of B vitamins, I have to say, is unusual. and I'm not, you said you have B vitamin toxicity symptoms. I'm not quite sure what you mean by what those symptoms are. Maybe from the symptoms that would give other clues as to why that B vitamin is causing problems.
It's vitamin D, not B.
Okay, well, vitamin D, that would be very unusual. Vitamin D is usually very well tolerated, and it's one of the most important anti-inflammatories in the body. So, I think that must be one of the very few cases. Usually I don't worry about vitamin D at all because it's so well tolerated. So I'm very surprised that you're getting those symptoms. Maybe there's an allergic component there. I'm not sure, but that is most unusual.
Then we have one who's asking, how do we increase the thyroid function?
Okay. Basically, you take a thyroid supplement. Now, I could speak all day on thyroid therapy. Again, I've written a book about this, and I've called it The Underactive Thyroid. Do it yourself because your doctor won't. And the awful thing is that the underactive thyroid is incredibly badly treated, not just in UK and USA, but the whole of the continent as well. And this is another reason why it's so important to get to grip with your own illness. So take responsibility for your own illness, work it out from yourself from first principle, and maybe with help from therapists. But the underactive thyroid, the diagnosis is often missed because the doctors only rely on blood tests. Now, to diagnose the underactive thyroid, you have to look at the clinical picture. Yes, we have the clinical picture is fatigue and poor energy delivery mechanisms, but there are some symptoms which are peculiar to the thyroid gland. So one of that is fluid retention. So people, if they have an underactive thyroid, they tend to retain fluid, and they have the puffy face, puffy legs, maybe swelling of the tissues around the wrist, which presents with carpal tunnel syndrome, maybe other nerve entrapment syndromes in the neck, or maybe sciatica. They tend to lose their hair, so the hair goes very thin. Typically, they lose eyebrow hair. Is another typical symptom. Very often they become owls because thyroid hormones are responsible for our circadian rhythm. And if you are underactive with the thyroid, then very often you can't get off to sleep until late at night, and maybe you don't wake up until 8 or 9 o'clock in the morning. That's another typical symptom. At rest, the pulse is often slow, often less than 70 beats per minute, maybe just 50 or 60 beats per minute. That's another clue. It runs very strongly in families. You run cold. When you measure your core temperature, you're running cold. So all these symptoms give us a clue that there's a clinical picture of the underactive thyroid. And then we have to do blood tests. Now, the main reason to do blood tests is to make absolutely sure you are not overactive with the thyroid, because the last thing you want to do is give thyroid hormones to somebody who's overactive. And then we can access thyroid hormones very easily online. They're called thyroid glandulars, and they come from they're dried pig thyroid gland, or maybe dried cow thyroid gland. But the point is they do contain active hormone, and they are called thyroid glandulars. And the key here is to start with very low doses and build up the dose very slowly. Now, again, there are details in my book, and there are also details in my book of where you can access these worldwide. And you don't need a doctor's prescription for these. So they are very helpful interventions, and the underactive thyroid is a common problem in people with fatigue syndromes.
I know it's completely individual how long time it takes for patients to recover, but can you say what's the average of time is for your patients to recover?
Well, I tend to get the difficult cases. I get the cases of people who are very severely ill for obvious reasons. And some people, I freely admit, I'm still struggling with. I don't have all the answers to everybody who comes to all their symptoms. But, people we're talking about recovery in weeks to months, and sometimes months to years. Now, getting well is like building a house. You have to put down the foundation stones, and for us, the foundation stones is the paleo ketogenic diet, and then we build on that the supplements, the mitochondrial stuff, the thyroid stuff, the adrenal stuff, and then we look for the chronic infections, and we try and identify what they are and reduce those, and then we look for the allergies, and we try and identify those and treat those. And It's no good saying, oh, the diet didn't do me any good. Well, forget that. We'll do something else. We have to hold all these things in place and keep building and building and building until you are improving and continuing to improve. Now, I don't mind how slowly people get well, so long as they're gradually moving in the right direction. At the point at which they plateau, at which they get stuck, then yes, we have to start thinking, what else can we do? What more can be done? And, you know, I'm always asking questions and listening to podcasts and getting new ideas, and you must do the same. You know, get as much information you can and ask yourself, does this fit with me? And then you put it into practice until you start to improve again. And then when you get to a level of wellness, when you are as fit as your friends and your contemporaries and you can do all the things you want to, then you can maybe start to relax the regime. Can I get away without this? Can I get away without that? But in parallel with this, all these interventions we're talking about, the diet, the fermenting gut, the supplements, they all prevent us dying from heart disease and cancer and dementia. So, and you know, and there's an old boy I look after. He's no relative of mine, but he's a friend. He's been a friend for years. And of course, he lives in my granny flat. I look after him. He does a paleo ketogenic diet. I give him supplements. And in July, we celebrated his 101st birthday. Now, he is completely au fait. His brain is as sharp as a tack. He has no heart disease. He has no cancer. And that's how I want to live. I want to live to my full potential, functioning at a high level for as many decades as I possibly can. And you are all the same. So, you know, it's relative. So, you know, all these interventions, I know I can guarantee will improve your health. But you have to watch out for what I call die-off reactions, detox reactions, Herxheimer reactions. It's going to be a bumpy ride for you. And don't be put off by the bumpy ride. You have to know that these are the right things to do and keep plugging on. But if you do get worse, then you just have to relax the regimes, let yourself recover, and then gradually put them in place again. And remember, the sickest people have the bumpiest ride. The sickest people have to go the slowest. The sickest people are the ones that I obviously struggle with most.